During today's in-service, we'll be focusing on patient protections, specifically confidentiality, informed consent, and advanced directives. These topics are very important for all health professionals to be familiar with so that all patient rights are respected and upheld when we are providing care to them. Let's begin by discussing the basics of confidentiality. According to the National Council of the State Boards of Nursing, or NCSBN, any patient information learned by the nurse is information that should be safeguarded. This information should only be shared with other healthcare team providers for healthcare purposes. Patients entrust us with their most private information, and we must respect them by guarding this information and using it only for things that will benefit them. Here are some points to remember to ensure patient confidentiality is upheld in the workplace. Log out of all electronic health records when not in use. Walking away from the computer with a patient's chart up allows any passers-by access to their chart. Keep printed patient information at the desk to a minimum. This helps when visitors or other patients come to the nurse's station and have wandering eyes. Any printed information at the desk should be turned over so that it is not visible and kept at the back of the desk out of the view of visitors. Keep quiet. Be mindful of discussing patient information at the desk when visitors or people not in the patient's healthcare team are within earshot. With social media usage on the rise and different outlets becoming more and more popular every day, prudent nurses should always keep patient confidentiality in mind with their social media posts. The NCSBN has come up with a few guidelines to help avoid potential problems regarding social media. Your social media posts should not contain any patient images, patient name, or patient information that could identify or hint that the patient was present on the unit. I feel with the popularity of selfies, it should be mentioned that patient information should not even be kept in the background of a picture. Even if you think you cannot read or see the information in the background, retake the picture in an area where no patient information is visible at all. Privacy settings do not ensure that the information is safe to post. There are so many ways to get around privacy settings that they do not guarantee that your post is 100% safe. A 2015 article suggests that posts made outside of work that could cause embarrassment or have detrimental effects to the healthcare organization's reputation and/or patients are grounds for dismissal. Be respectful of your patients, your workplace, and most of all, yourself when you post anything on social media. And always refer to your institution's social media policy for their specifics. Our next topic of discussion is informed consent. Informed consent should always contain a description of the procedure, risk and benefits of the procedure, and reasonable alternatives along with their risks and benefits. The physician is responsible for going over the procedure, risks and benefits, and alternatives with the patient, as well as obtaining the consent. The patient should be of sound mind when giving informed consent. They should not be under the influence of any mind-altering drugs or substances so that they can make the best decision for themselves. It is often the nurse's responsibility to witness consent forms being signed at the bedside. During this time, the nurse can answer questions regarding nursing care, but questions regarding medical care should be referred to the physician. It is also the nurse's responsibility to ensure that the consent is available in the patient's chart before the procedure takes place. If the consent is unable to be found, the procedure should be put on hold until a new consent is signed. The last topic for today's in-service is advanced directives. The following documents can serve as an advance directive document to make a patient's wishes known if they become unable to make a medical decision for themselves. The first one is a living will. This document provides detailed directions for life-saving medical interventions, but does not appoint a designated representative of the patient to make these decisions. The second document is a durable power of attorney. This document appoints an individual to represent the patient and act out their wishes on the patient's behalf. This document gives the individual the decision-making authority for the patient's healthcare decisions. The last document is an advance directive. This document combines both the living will and the power of attorney documents. Detailed instructions are listed as in a living will, and a proxy or individual can also be listed if these instructions need interpretation. It is the nurse's responsibility to ask the patient if they have an advance directive upon admission to the facility. If the patient has an advance directive, the nurse should ask for a copy and add it to the patient's chart. If the patient does not have an advance directive, the nurse should educate the patient on what an advance directive entails and then provide the patient and their family with information on how to obtain an advance directive. The presence or absence of an advance directive and the actions following should be documented. Thank you for attending today's in-service. I hope you have all learned something new or were refreshed on patient protections. Have a great rest of the day.